All right, so without further ado, I'm honored to be able to introduce Dr. Mona, MD, MPH, an Associate Professor of Pediatrics and Human Development at Michigan State University. Dr. Mona is also the founder and director of the Michigan State University and Hurley Children's Hospital Pediatrics Public Health Initiative, a model program to mitigate the impact of the Flint water crisis so that all Flint children grow up healthy and strong. Please give a warm welcome to Dr. Mona.
Thank you. I can feel the energy and the hospitality and the warmth here, and I am so excited and humbled to be here with all of you. I still pinch myself that this book was selected as your state book. That's amazing. You write a book and you don't know what the kind of uptake will be, and this has been just surreal. So thank you for listening. Thank you for caring, and thank you for really being excited about this story, which is very much a story of crisis, resistance, and hope. And I want to start by kind of really grounding us in why we do this work. So we're the public health kind of medical people, like the folks that work for the department, do advocacy work in the community, elected officials, human beings, okay, all of us, all right. So all of us in many of our different professions, we do things for a reason. So for me in medicine and public health, I am grounded in children, and that is why I wake up in the morning. That is why I'm in this profession. And for those of us in the larger world of public health, it's people and it's communities that we are privileged to serve is why we do this work. But for me, it is definitely our kids. And I want to start by sharing a passage from the book that's early on about one of my kids, one of my Flint kids, Nakala, who came to clinic for her 4-month checkup. It was before really I knew anything that was going on with the water. She'd come to clinic with her older sister, her 2-year-old sister, with her mom. And I'm going to read you this abbreviated section. Riva's 4-month-old baby sister, Nakala, had been in the clinic for a routine checkup. I was the supervising pediatrician. Nakala's mom, Grace, told us she wanted to stop breastfeeding. I urged her to continue, but she said she'd made up her mind. Breastfeeding took too long and was a hassle. Plus, she had to go back to work. She was a waitress, and there was no place to pump in the restaurant except the restroom that all the customers used. She couldn't afford to do anything that would jeopardize her job. As it was, she wasn't getting enough hours to make ends meet. She planned to switch to powdered formula mixed with water, but had some concerns. "Is the water all right?" she asked, looking skeptical. I heard things. Riva, the older sister, walked toward me with her hand out. Kids love to distract a doctor who's giving total focus to a younger sibling. So I turned my full attention to Riva, and she placed a torn scrap of paper in my hand, and it had masterful crayon scribbles. And she had a sheepish smile as she was handing me a secret message. And I said, "Thank you, Riva," I whispered. "I'm going to keep this right here in my white coat pocket," which is really the only reason we have white coat pockets, to put stuff in it, like beautiful art pieces. Then I sat her down on my lap. The water. I'd been asked about it before. And I said, "Don't waste your money on bottled water." Nodding at Grace, the mom, with calm reassurance, the way doctors are taught. They say it is fine to drink. Inches away, Riva watched me carefully. I smiled at her again, gave her an extra squeeze, and then put her down. I patted Nakala's fuzzy little head and touched her fontanelle, or soft spot, out of habit to check its size. It was my chance to explain to Grace that her baby's skull was open because her brain was still growing, and that this was the time to stimulate her baby with singing and talking and reading. Then I gave Grace another nod. The tap water is just fine. So by now you know that our tap water was not just fine. And you remember seeing those pictures of Flint water, that brownish, kind of yellowish water that was coming out of people's taps. And I think for many of us, it was more convenient to believe that it was like fake news or photoshopped, or like somebody poured like iced tea over that, through that faucet. But by now you know that the story of Flint is the story of really the most emblematic environmental and public health disaster of this young century. It is a story of what happens when the very people responsible for keeping us safe and healthy care more about money and power than they do about us, and most importantly, about our children. But one of the reasons that I wrote this book and that I'm here with you today is very much to share that the story of Flint is not isolated. It is a story that speaks to the deeper crises that we are in right now as a nation. The disintegration of critical infrastructure, environmental injustice that disproportionately affects the poor and the minority, the disrespect for science and facts, an assault on the promise of our children, and most of all, a disregard or a blindness for people and places and problems that we choose not to see. And despite all of this badness, the story of Flint also has incredible lessons for us. Yes, it is a story of a crime committed with absolute indifference against some of the most vulnerable people in our country. But it is also a story of how everyday people, moms and pastors and activists and journalists and scientists and doctors, said, "We've had enough," and took action on behalf of our children. So that is a story that we all need right now, because it's almost a playbook of resistance and hope for our children. And I want to kind of, if you've read the book, you know that it has a lot of intercessions into history. So hopefully it's not like fall asleep, like boring history, but it's like fun, exciting history. My favorite thing to say is this quote on the bottom from Oprah, who put this book on her summer reading list, that said it had the gripping intrigue of a Grisham novel. So it's like really exciting history and science. So I want to digress into a little history, because we walk over complex systems every day. We walk over history every day, yet we do a really good job closing our eyes to anything that's too complicated and too dark to process. But the history is important, because if we want to solve our complex social public health problems moving forward, we have to start by looking back. And the history of Flint, there's so much irony, because Flint was really a place of extremes, where greed met solidarity, where bigotry met fairness, and really where the struggle for equality played out in our nation. And I really want to walk around, so I'm going to grab the other microphone. Hold on. So what was Flint famous for before our water crisis? Hello. Okay. So cars, yes. So Flint was the birthplace of General Motors. But more importantly than the birthplace of General Motors, and someone also already mentioned it, Flint was the birthplace of unions, of resistance and disobedience and contracts. So in the 1930s, shortly after cars were being made in Flint, auto workers did something totally disobedient and radical and illegal, and they shut down operations of all the car plants in Flint, demanding things like living wages and occupational health and safety. And they won. Their union was born, the UAW, and what was born after that was really the middle class. The bargain that was created was something called the Grand Bargain, which brought into place things like living wages and healthcare and housing and pensions. And it established a precedent that translated throughout the country. It set wages across the country because of the resistance and the disobedience of the auto workers in Flint in the 1930s. And also not lost in the story was the role that women played in this movement. Incredible women stood by the side of those auto workers as well as the children, and were critical kind of organizers and strategists to make sure that people had a chance at opportunity, had a chance at prosperity. And it wasn't even that long ago, 1970s, and this is so hard to believe, that Flint had the highest per capita income in the country. Yeah. Can you believe that? And do we have any Flintstones here? Anybody from Flint or Michigan? Yeah, you do? You're from Michigan? Michigan. Okay, so this Flint. Oh, you're from Michigan out there? Yeah, the bookseller. Okay, awesome. Charge extra. Just kidding. Okay. So 1970s. Can you believe it? Flint had the high. People in Flint made the most money anywhere in the country because of that incredible prosperity, and because of that, we had some of the best public health indices in the country. And then the history that followed is also critically important to understand and not to gloss over, because that history that followed was driven by inequity, driven by greed, driven by racism, driven by neglect. Those plants closed, and jobs were lost. The people who had the power and the privilege to leave certain neighborhoods left those neighborhoods. And poverty and violence really became epidemic in the city of Flint. So you can think, like, Flint was on the bottom of any list that you can think of. County health rankings, violence reports, what have you. One of the most violent crime rates in the city before this water crisis. I was caring for kids with lead poisoning because of retained bullets, because of kind of the widespread violence in our city. So Flint really was in crisis for decades. Very much a place, like so many in our country, where the zip code of your birth is really the greatest predictor of where you end up. A child in Flint actually lives 15 years less than a child in an adjacent neighboring zip code. 15 years. But that is not unique to Flint. That is throughout this country. And that's really kind of what drew me to come to Flint, to come back to Flint. I was a medical student there about 20 years ago, and I came back to Flint in 2011 to not only be a pediatrician to treat infections, but to be a pediatrician that really works to address the underlying inequalities and inequities and injustices that our children were facing, the root causes of many of their issues. So Flint was in this kind of massive economic crisis, and in 2011, which happened to be the same year that I came back to Flint, but I don't think it's related, we lost democracy. So Flint became under the control of emergency management because of being in this near bankruptcy state. And at one point in Michigan, half of our African American population was under emergency management, compared to 2% of our white population. So grossly undemocratic and grossly unjust. And the emergency manager had one job, and that job was austerity. It was to save money, it was to balance the books, it was to cut. No regard for public health or children's health or the environment. And they decided that the water that Flint had been getting from the Great Lakes for half a century was now too expensive for this predominantly poor and minority community. And that we would start drawing our water from the local Flint River until a new pipeline to the Great Lakes was to be built. And on April of 25th of 2014, so we are approaching our 5-year anniversary in a couple of weeks, with a very kind of simple press of a button, our mayor went on TV and we started drawing water from the local Flint River. And right away there was concerns. The heroic people of Flint were loud and they knew something was wrong with our water. It was brownish and greenish and yellowish, and it smelled weird, and it tasted even funnier. We had a lot of bacteria issues, so there was boil advisories. And then they added a lot of chlorine, the disinfectant, to kill the bacteria, but people felt like they were drinking like a cup of bleach or a swimming pool, and just the added chlorine irritated people's skin and eyes. Then we had so much chlorine in our water, it created a buildup of disinfectant byproducts, something called total trihalomethanes, which is a mouthful, and that's a carcinogen. So lots and lots of issues with this water. Many, many, many red flags with this water. And I think the biggest red flag happened just a few months after we switched our water source. Within a few months, General Motors, which was born in Flint, still has plants in Flint, noticed that this water was corroding their engine parts. So they were allowed to go back to Great Lakes water. Yet the people of Flint were told to relax, that everything was in compliance, and that everything was okay. So it turned out that this water wasn't being treated properly. It was missing an important ingredient called corrosion control, which I had never heard about before this. And without that ingredient, our water was about 20 times more corrosive than the water that we had been getting from the Great Lakes. And that's what was corroding the engine parts. But it was also corroding our old plumbing. And I didn't even know about the possibility that there was lead in plumbing, or that kids could have lead exposure from plumbing, despite being a pediatrician in Detroit and Flint, despite caring for hundreds of children with lead poisoning. The possibility of water was never on my differential, which as doctors is that long list of possible causes of something. I never even knew that there could be a possibility of lead coming from water, which also speaks to my blindness, because I didn't even know what the word lead meant. Who knows what the word lead means?
It's a metal that it's soft and it's used for a variety of things.
Sure. What's the elemental symbol for lead?
PB.
PB. The elemental symbol for lead is PB. It comes from the Latin plumbum, which means plumbing. So lead means plumbing. When the Romans built their aqueducts, they used lead plumbing, and there's actually strong theories that hypothesize the demise of the Romans is because they used so much lead in their plumbing. They also put it in food like salts and stuff, so totally not recommended. Yeah, not a good idea. So since we started putting lead in our plumbing, and it was this wonderful metal because it was malleable, you could shape it, you could turn it, you could make all these pipes. We've seen issues with it. There's been over a century and a half of issues with lead in plumbing. Flint is absolutely not the first time. There was a water crisis in DC a decade ago, but many crises throughout history, both in the US and Europe, with lead in our plumbing, yet the lack of any political will to do anything about it. Our pipes were so corroded from this water that the folks at the EPA actually said it was like drinking through a lead-painted straw. And we never knew when a piece of kind of corroded lead scale was going to come off of our pipes into our drinking water and into the bodies of our children. To give you a perspective of lead levels in water, which was really new information to me as well. So the EPA has something called the maximum contaminant level goal for lead in water, recognizing there is no safe level of lead. That is set at 0 parts per billion, but that's aspirational and not enforceable. The American Academy of Pediatrics has set a recommendation of an action level of 1 part per billion for lead in water in schools and childcare facilities. To date, there is no federal regulations that look at lead in water in schools and childcare facilities. The FDA, which governs bottled water, has an action level set at 5 parts per billion. The World Health Organization has an action level of 10 parts per billion. And the EPA has a non-health-based, non-science-based action level for lead in water for a water system set at 15 parts per billion. Has not been updated. The EPA recently said we're not even going to update it, we're just going to continue to pass the buck. And that's set at 15 parts per billion. Throughout the city of Flint, our lead levels in our water were in the hundreds and thousands of parts per billion throughout the city. We had a home with a lead level of 22,000 parts per billion. My lowest day in this whole crisis was when I found out a home adjacent to our hospital for troubled children and foster kids had a lead level in their water of 5,000 parts per billion. So throughout the city, going on really for months, about a year and a half. And it was really brought to light because of a water scientist who came to Flint from Virginia Tech, Mark Edwards, who uncovered the Washington, D.C. lead and water crisis. When he found out from an amazing mom in Flint that there was lead in her water, that they weren't using corrosion control, he literally packed his minivan overnight with graduate students and supplies, drove up from Blacksburg, Virginia, which is like nowhere, to Flint to work hand in hand with the people of Flint, truly doing citizen science to sample the water and transparently sharing that there is lead in water throughout the city. And just like everyone else who had raised concerns about this story, the state said he was wrong. They actually called him a magician, that it was like that he was pulling rabbits out of hats, saying wherever he'd go, he'd pull lead in water levels. So when I heard about the possibility of lead being in the water, there was no going back, because as a pediatrician, when you hear the word lead, it's a hard stop. We know what lead does. We respect the incredible science that has gotten us to the point that we now know that there is no safe level of lead. Yes, we had higher lead levels back in the day when industry put lead in paint and lead in gasoline and lead in plumbing. But at the same time, we have learned so much through incredible science, and we now know that there is no safe level of lead, and that our focus in public health and medicine should be primary prevention. We should never expose a population to lead because it is an irreversible neurotoxin. Our work should be to find it in the environment before kids are ever exposed. For far too long, we have been using children as detectors of environmental contamination. So, when I found out about the possibility of lead in water, I freaked out. And I also freaked out because I know that it is a form of environmental injustice, environmental racism. Our kids in Flint already had higher lead levels, just like kids in Detroit and Chicago and Baltimore and Philadelphia, and probably more kids in Providence than outside of Providence. The burden of lead does not fall equally on our nation's children. And so I knew that if I was going to kind of make a difference in the story, I would need science, I would need data, I would need facts proving that our children were in harm's way. But remember, I never should have needed that, because we're supposed to do that thing called primary prevention. This crisis never should have started. Should have stopped when that first mom held a jug of brown water. But it definitely should have stopped when we knew there was lead in our water. So I never should have had to prove that it was increasingly in the bodies of our children. So in kind of rapid detective speed, conducted the research, saw that yes, there was more lead within the city of Flint's water limits, an increase in the percentage of kids with elevated lead levels within the water limits. Nothing happening outside of the water limits, outside in the rest of the county. And in areas where the water lead levels were the highest, we saw the greatest increase in children's blood lead levels. So correlated with what was happening with the water. And then I did something that was totally an academic no-no. So academics out there, how do you share your research? Peer review process, you publish, how long does that take? Years. Takes a long time, takes forever. So our kids in Flint did not have another day. So I literally walked out of my clinic and stood up at a press conference, up behind a podium. It was taller and I was shorter, sharing this research that our children were in harm's way, and that we needed to take precautions and get filters and hopefully, switch our water source. And I felt great for a minute. I'm like, yes, we are sharing our science. This is awesome. We're going to protect kids. This is why I went into pediatrics and public health, is to protect and care for children. And then just like everybody else, like I said, who had raised concerns about this water, I was quickly attacked by the state, who said I was wrong, who said that their surveillance data wasn't consistent with my data, who said that I was an unfortunate researcher and that I was causing near hysteria, which is my favorite because that was also sexist. So for a minute, I believed them. I was scared and I felt sick, and there was literally a knot in my stomach that wouldn't go away. I had just gotten a Fitbit. I knew my heart rate, it was close to 200. And I thought to myself, maybe I should have just kept my eyes closed. Maybe I should have just gone on done my busy work, busy mom, busy pediatrician, busy medical educator. Why did I have to get into this? And that lasted a really, really quick second, because it was the realization that this had nothing to do with me, but everything to do with my children. My research, my numbers, they weren't numbers. Every single number was a kid. And a kid that I had probably even seen in the last year or so, but a kid that I, as a pediatrician, have literally taken an oath to protect. So it was almost as those kids jumped out of those spreadsheets and lifted me up and gave me the courage to fight back for our children. And we fought back with more science and more evidence. And then there was a growing team of folks who had our back and who had also begun to raise their voices. And finally, it took a while, the state did concede, said, oh, actually, your data's right, or it's consistent with our surveillance data, there is a problem. And within a few weeks, we were back on treated water. So there's two important lessons here in this part that, I mentioned that I took an oath to protect these kids. Implicit in the story is that, doctor or not, we have all taken an oath to protect children. It is all very much our civic and human responsibility to stand up and to fight for children. Also implicit in the story, especially for those of us who live in the world of public health, we live and get lost in big data sometimes, and we have to sometimes take a step back. What do your numbers mean? What do they represent? What will you do for these kids, and what risks will you take? So since the moment of kind of recognizing this population-wide crisis, which was more than just lead. We had one of the largest outbreaks of Legionnaire's disease because of the water. People died. Thus, there's homicide charges against officials. We had skin issues. But by and large, this was a trauma added to a population already rattled with so many traumas. It was a trauma of lost trust, betrayal, anger, fear, guilt, anxiety. And just those emotions in and of themselves can lead to poor outcomes. So Flint is a story of what happens when we deny science. It's a story of science speaking truth to power. And we are leaning on the incredible science and emerging science of child development and brain plasticity and toxic stress and resilience to mitigate and buffer the impact of this crisis. And that is how I get to spend my everyday right now, is building a model public health program so that we do not see the consequences of what happened. And most importantly, to be able to shine a light on other places where kids are waking up to very, very similar nightmares. Like I said, the story of Flint is not isolated. Black, brown, white, rural, urban, too many of our nation's children wake up to the same issues of poverty, injustice, lost democracy, austerity, and stolen opportunity. Situations that do make zip codes more powerful than genetic codes. So what we've been able to put into place now in Flint is awesome. So things like expansion of home visiting programs. We have 2 brand new high quality childcare centers, massive expansion in early literacy, primary prevention, home investigation and abatement, healthy homes work, Medicaid expansion, nutrition support, breastfeeding services, mindfulness in our schools, school health services, and the list kind of goes on and on of these things that we've been able to do for children. And I am not naive to think that kids live in a bubble. We are also working on the upstream issues, the bigger things that families, communities, neighborhoods need to be healthy. Things like living wage jobs and economic development and participatory democracy and restorative and environmental justice and self-determination. All these bigger things that we know can tip the scales to make sure that children not only survive but thrive. And that's the privilege of the work that I'm able to do today. And we already have begun to kind of export our hope a little bit. My clinic in Flint, our pediatric clinic, which sees the most Flint kids, we're on the second floor of a farmer's market. I talk about this in the book, and it was a purposeful move because we have no full service grocery stores in Flint. And I used to tell my patients, you should eat avocado and kale, and they would just stare at me. I'm like, where am I gonna get that and how am I gonna afford that? So we put our clinic on top of a farmer's market, and every kid that comes in, be it for an ear infection or a well baby checkup, gets a prescription for fruits and veggies, which they fill downstairs in the farmer's market. We robustly, as academics, evaluate this, and because of the success of kind of our little program, our U.S. Senator Debbie Stabenow was aware of it and has been to the clinic. So she put a nutrition prescription program in the U.S. Farm Bill, which passed Congress, which was signed by the president. So that is just one example. So one tiny example of how our work, where we really hope to take what we're doing in Flint and share it with the rest of the country, because like I said, these are not isolated situations. And I will end before we go into questions with one last part. So the title of the book is What the Eyes Don't See. So it's very literal, so we don't see lead in water. We also don't see the effects of lead. Kids don't present to clinic or ERs anymore with acute lead poisoning. It's known as a silent pediatric epidemic. But by and large, the title of this book refers to, like I mentioned earlier, people and places and problems that we choose not to see. But I hope that this story really is a rallying cry for all of us, no matter who we are or what we do, to open our eyes and each other's eyes to the injustices that are happening right around us. But it is not enough to just be awake and alert. I hope that this story also empowers you and inspires you to act, even when it's hard, even when it's scary, even when it may seem impossible, especially on the behalf of our children. And then hopefully then we will see kind of a world of public health that we have yet to see. A world where the trajectories of our children are not based on zip code or school district or state of birth or country of origin or gender or drinking water source. So a world where their trajectories are based on equality and opportunity and democracy. So that's really very much kind of the underlying lessons of this book is really about who we are and who we want to come. And if you read this book, you also very much know that it is not just a Flint story. People are like, I thought it was just going to be about Flint. Like, why do I have all this other stuff about this doctor? So it's very much also a book about me, which means it's also a first-generation immigrant story. So I came to this country when I was 4, fleeing the regime of Saddam Hussein in Iraq. We came here for what everybody comes here as immigrants for freedom and opportunity and democracy. And that American dream was absolutely realized for me and my family. And I wake up every day so lucky to be here in this country, but also acutely aware of what people in power can do to vulnerable populations. As such, kind of I was raised in this milieu of serving my community, no matter where that community may be. So that immigrant thread is a big part of this book, and that is purposeful because of our current political climate. I felt that it was important for folks to see that we are actually corroding the American dream for so many children who have the same kind of color of skin like me, who want to come to this country for the same reasons that I was lucky enough to come to this country for. So another kind of big theme that is also in this book.